So it was a homeopathic remedy. Let's say that he started homeopathy and acupuncture at the same time. If my patient gets better, it may be that both treatments have helped him. But if and acupuncture can treat also chronic predispositions if given deep and for long. But if the miasmatic and constitutional characteristics of my patient have improved, then I know that I have given the simile. You see, when you are well acquainted with the actions of the homeopathic treatment, what can homeopathic treatment achieve, then you know the differences from other therapeutic treatments. Now, okay, there is no problem on giving both concerning the conclusions of what has acted and if I gave the simile. But what about problems of side effects or contradictions between allopathy and homeopathy? In order to see, apart from the data from the clinical practice that shows us that there is no problem in combining the two, from my clinical experience, there are theoretical matters to see. Allopathy acts on the material level. Homeopathy acts on vital force, on the energy level, on the etheric level. Vital force. The homeopathic remedy acts primarily on the energy level. And then this course goes up to the psychological level and down to the physical or material level. Allopathy acts with chemical remedies, chemical material drugs. Homeopathy with energy drugs, remedies. Homeopathy acts on the whole, while allopathy acts partially on organs, tissues, and so on. So, when there is no confusion between them, only if they were both energy actions contradicting one another, yes. Or if we give an allopathic remedy, drug, that causes increase of the blood pressure, and another one that causes decrease of the blood pressure, then we have contraindications. So the answer is that homeopathy is not antidoted by any kind of allopathic treatment, except from only a few painkillers that have caffeine in them. Okay. All the rest, antibiotics, cortisone, chemotherapy, immune suppressive drugs do not antidote, do not neutralize the energy push of the homeopathic remedy. Nevertheless, what can they do? because they act on the physical level, if they are drugs that suppress the disease, suppress the illness, or if they are drugs that suppress the immune system, or if they are drugs that have severe side effects, that is, they poison the organism, then we don't have a neutralization of the energy push of the homeopathic remedy to the vital force of the organism, but we do have problems when the energy push comes and gives a physical push and order and balance to the physical body. Then if this physical body is with these problems, then we have a negative action of the allopathic remedy. For example, I give the homeopathic remedy, the person starts getting better, but then he starts chemotherapy. Chemotherapy is a poison. It has severe side effects. It suppresses the illness. So the patient's state of health may get worse. But this doesn't neutralize the energy action of the homeopathic remedy. It changes the final therapeutic results, but not completely. For 30 years, I take and I treat patients homeopathically that are at the same time using cortisone because they have rheumatoid arthritis, chemotherapy because they have cancer, methotrexate because they have an autoimmune disorder, antibiotics and other severe drugs. These drugs, although they are given together with homeopathic treatment, do not spoil the case. The homeopathic treatment, they make it more difficult, they make the therapeutic result more difficult, but they don't spoil the energy homeopathic push to the vital force of the patient. They may hinder at the physical level the effort of the organism to bring order, but they don't antidote the homeopathic treatment. So we can do parallel homeopathic and allopathic treatment. And when a patient comes to us with severe problems already and taking already many chemical drugs, we should never stop his allopathic remedies that are remedies that are given for much time for chronically. We should start the treatment with the other remedies, and gradually when the patient gets better, and if he doesn't need anymore the other chemical drugs, and after we do many laboratory tests and confirm that he is better and he doesn't need the allopathic remedies, only then we should gradually stop the other chemical remedies. Either we stop them because we are also medical doctors and we can handle chemical remedies, or if if it is a very special field, for example, if he takes antipsychotic remedies, then we should cooperate with the, and we are general practitioners, we should cooperate with the psychiatrist that treats our patient, and in cooperation he will stop gradually the remedies only if the patient gets better and he doesn't need them. There should be no fanaticism to doctors, to medical doctors of any kind. Even if you are a homeopathic doctor, even if you are an allopathic doctor, an acupuncturist, and so on, we should cooperate for the benefit of the patient. Since homeopathy and allopathy can be combined as systems, why shouldn't we cooperate, we doctors, together, allopathic and homeopathic doctors? After all, we are all doctors. This is the main property. We are doctors. We may be homeopathic doctors because we employ mostly this therapeutic system. We may be allopathic doctors because we employ this therapeutic system. We may be osteopaths because we employ this therapeutic system. But we are all doctors after all. We have been trained in the same science, but we use the same diagnostic means when it comes to the diagnosis of the disease, but we use different therapeutic means. And that doesn't mean that if needed and for the good of the patient and for his survival, if we need as homeopaths to give also allopathic drugs, that we shouldn't give them. If I can help the patient with only natural means, with only homeopathic remedies, I will prefer to do it so. But if there is a need for the benefit of the patient to give also allopathic drugs or anything else, I should do it. It's my obligation. We shouldn't be fanatic. So, parallel treatment can be done. There are issues how to do it. There is no problem, no contraindications, and we should stop whenever we can the chemical drugs because they have side effects if the patient gets well and does not need them. And then we should stop gradually the homeopathic remedies also if we have cured the patient and he is well. Some patients say, can I do preventive homeopathic medicine even if I am well and continue the remedies? Yes, it can be done. We will not continue the same remedies forever. We can, the patient can consult us from time to time, and we can try to balance him as more as possible, even if he doesn't have problems. Because in classical miasmatic constitutional homeopathy, we focus on the chronic illness, that is, at the state of clinical health. So we can diagnose his chronic illness and his constitutional influences, even if he is at the state of clinical health, because we are focused on his characteristics, on his miasmatic and constitutional characteristics, and not on his symptoms, because when he is healthy, he doesn't have any symptoms, because he doesn't have any acute illness. Thank you.